Let's move to the step 5, in which we have to identify the rhythm. So look at this rhythm on the slide. Since the beginning we are following the same rhythm on each step. The analysis so far suggests the normal measurements, and the analysis showed no abnormality in this rhythm. Therefore, this is a regular sinus rhythm. Let's move to the last step, which is step 6, and let's document rhythm analysis. In this slide, we will learn to document rhythm strip analysis. This slide is one of the examples of rhythm strip analysis documentation, and in different hospitals you may find different documentation strips. So, if we combine all our analysis of rhythm that is used in this presentation, the analysis will be like this. The arterial heart rate is 70 beats per minute. P wave configuration or shape is upright, rounded and uniform. PP interval regular. The ventricular heart rate is 70 beats per minute. QRS configuration is narrow. RR interval regular. PR interval 0.16 second. QRS is 0.04 second. And QT interval is 0.40 seconds. All these are in normal ranges. Therefore, the final conclusion of our rhythm interpretation is that this rhythm is normal sinus rhythm. So, it's time for summarization. A step-by-step approach needs to be followed for rhythm strip analysis, and we have learned 6 steps to analyze the ECG rhythm strip. Step 1, determine heart rate. Step 2, assess P wave. Step 3, assess QRS complex. Step 4, assess PR and QT interval. Step 5, analyze rhythm. Step 6, document your findings. Thank you.